becomes, at the moment, a child will wait 8 months to 12 months for a referral, an appointment. So what do you do as a parent in the meantime with your child who is struggling, probably at the early, as you say, early intervention stages, where they do need an assessment, clearly. They need a clinical psychologist to assess them and decide which form of action, what sort of therapy do they actually need. And if they got that straight away, there's a very good chance that they may never reach the real chronic anxiety stages or depression, because we've nipped it in the bud. It's like any illness that a child is going through. As a parent, you would not expect them to have to wait 8 months to a year to see a specialist. So, yeah, something needs to be put in place for these children to be able to be assessed immediately.
What is it that people can be doing in the meantime? Because there's a lot of focus, as always, that we need more resources, more money, so we can fund more resources, more infrastructure, even just more staff coming to the island that are equipped to deal with these kind of issues. As it stands, we don't have those resources or that money. What can people be doing in that meantime when it seems a little bit like no man's land?
There are lots of private therapists out there who can offer great services, hypnotherapy, CBT, various things that you will have to pay for. These therapists are qualified, they need to earn a living, they have to charge. And if that's a possibility for you, then that's an option. However, I still think the child needs an assessment first before you know which therapist to use. So again, that's something that, we need to put in place, the early intervention and the assessment. But other things you can do from home, the best thing a parent can do is educate themselves. Educate themselves, whether it be going on the internet, reading through books, just educate yourself on teenage anxiety related issues and get as much information yourself as you can so that you can help your child. Talk to therapists, that sort of thing yourself. So the more information you can get and, the more expert you can become on your child's condition, then you will have an idea on what to do. Obviously, the schools are much better now, more equipped with listening services and just various sort of issues with regards to, they realise the need now for young people and in stressful situations, and anxiety-related issues are rising. So, yeah, talk to the school. A lot of the schools now will try and adapt the child's timetable to suit their issues and their problems. A lot of young ones, when they become really anxious, school is a big trigger for their anxiety and maybe panic attacks and that sort of thing, because it's a large environment, there's loads of kids around. For many reasons, it's quite daunting. So to become schoolophobic is quite a common thing for a child with anxiety. But I would say to a parent, any parent out there, educate yourself, read, talk to people, talk to the schools, be open about it, because hiding your child's anxiety, I realise there's still a stigma attached to mental health issues. Hiding it, if it's going to become a long-term thing, is not going to help the child in any way. You need to talk to people.
Is the way people can educate themselves now a lot easier, would you say, than it certainly has been in the past?
Certainly has been. 10 years ago, when I first kind of was looking for support as a parent, there was very little out there. Nobody really wanted to talk about it. There's so much more now. As soon as you type into Google mental health, anxiety related issues, there will be a whole load of things come out there. There's lots of websites that you can access now. Young Minds is brilliant. They're based in the UK. They do have a parent lounge as well, as they call it, where you can ring in and you can talk. We're a small island. People don't necessarily want to ring us as a charity in case I know them or somebody else who answers the phone or will contact them will know them. It's very difficult to be private on this island. But there's alternatives. You can get in touch with people in the UK. Samaritans are brilliant. They're very much equipped now with issues for young ones. Young teenagers can even text Samaritans and Young Minds themselves, so you could give that to your child and they can have someone to contact via text message. There are quite a few things out there, but I would just say don't hide it. Don't be ashamed of it. The child needs support immediately. Don't wait around. Get something in there as early as you possibly can.